A recent study shows that stroke-related deaths are projected to rise among millennials as they get older. Researchers suggest that obesity and diabetes could be a cause. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, during Stroke Awareness Month, we're talking about this trend, who's at higher risk, and stroke prevention. With me today is Dr. Karin Olds, a neurologist and stroke medical director of St. Luke's Marion Bloch Neuroscience Institute. Thank you so much for joining us.
Thanks for having me, Lindsay.
So first of all, Dr. Olds, how prevalent is diabetes and obesity in stroke patients, and what role does that play when it comes to strokes?
Well, when we work up our stroke patient population here at St. Luke's, we see a lot of folks that are overweight and a lot of diabetics. Many of those don't know they have diabetes or pre-diabetes. Very prevalent.
Okay, and you're seeing more and more younger patients with strokes as well.
We do. We see a lot more young folks with strokes than it seems like we did in the past. And as our younger people are aging, we're seeing middle-aged.
Okay, now we know that 80% of strokes are preventable by having a healthy lifestyle. What things can people do to prevent a stroke?
Well, certainly exercise and eating healthy are at the top of the list, but important too is to know what your risk factors are. So checking blood pressures at home is important. If you do have diabetes, knowing what your blood sugar runs, knowing what your hemoglobin A1C is, really just knowing your risk factors and making sure that you're visiting doctors regularly.
Right. Now, along with that, the study mentioned a lack of access to health care. Why is it so important to see your doctor regularly, and what should you talk to them about?
Well, I think those things that we just mentioned about knowing how your blood pressure runs on its own, taking that, keeping a log, taking that into your doctor regularly, knowing how your cholesterol runs. So seeing the doctor on a regular basis and knowing what those risk factors are, but monitoring them at home as well.
Because you can think you're healthy, but if you haven't seen your doctor in a long time, there may be something going on that you don't know about.
We see that every single day here at St. Luke's in our stroke patient population. Folks think that they're healthy. They say, I've never had high blood pressure before. My cholesterol's fine, but they really don't check and don't know.
Okay. Now, what are the warning signs of a stroke?
We teach the acronym B FAST. So B is balance, and that is more really a room-spinning vertigo. E is eyes, sudden loss of vision or sudden onset of double vision. FAST stands for face, arm, speech, time. Face is a sudden onset of a facial droop, arm weakness, loss of speech or slurred speech. And then T stands for time, and that's probably most important. Call 911, get help right away.
Okay, why is that most important? Why is it so important to seek care immediately?
Well, we know 32,000 brain cells die every second, that the brain's denied oxygenated blood. But really, we have a very short window of time to be able to reperfuse the brain. So the clot busters that can be given in the emergency setting after the CT shows no hemorrhage, we really can only give those within 3 hours, maybe 4.5 hours in certain patients from the time the symptoms start. And then our stroke reversal therapy for large vessels that are blocked with our neurointerventional team. Again, once you already have damage done in the brain, then it's too late to open that back up. So if you can get that brain reperfused quickly, you stand the best chance of reversing stroke symptoms and living a normal life after that.
Okay. Well, thank you so much for joining us.
Thanks for having me.
To learn more about the different types of stroke and the stroke care at St. Luke's, visit stlukeskc.org/stroke. Thanks again for watching. We'll see you next time on Health News You Can Use.